So I've been exposed to this for ages, but it really brings it to light when you have someone working alongside you. You're teaching them, you're talking about what you're doing, you're discussing each patient and each consultation with them. And to have Ellen so surprised by how many patients have been having treatments for many years at other clinics, and then they land in our treatment chair and they're shocked when we start rattling off the risks of the medical treatment that they are about to consent to. Also, since opening this new clinic about 2 months ago and having that influx of new patients, this is feeling more prevalent than ever before.
For sure.
I also think that this episode is happening at a great time because in the last couple of weeks, some new updates have happened to the regulations of the cosmetic industry by AHPRA, which is the regulatory body for medical professionals in Australia. And interestingly, it gained all this popularity on social media by non-medical professionals having this absolute freak out that they would need to see a GP or a psychologist before their next anti-wrinkle treatment, which is not true, by the way. We can debunk that myth right here and now. And these updates mostly focus on cosmetic surgeries and mental health, such as body dysmorphia. But in terms of cosmetic injectables, we already consult you and screen for things like body dysmorphia and other mental health issues. We utilise telehealth with our team of medical doctors prior to doing any of the treatments, and we also follow all the regulations for registered nurses within this space. So a huge misconception of the cosmetic industry in the last few years, as the industry is growing rapidly, is that these are beauty treatments and people aren't taking these risks seriously, when in actual fact these are medical treatments performed by trained medical professionals, and these risks need to be discussed with every patient, every treatment, every time, as we do. So I think this is also why the new updates really blew up on social media, because people seemed shocked but also unaware of the processes that we already follow. I think it was like they were suddenly like, oh my gosh, there's all these changes, but I don't think they'd ever stopped to realise that there were regulations already in place, that these things are actually really only minor changes that are going to have to happen to the way that we do our consultations. And our patients probably won't even notice these changes.
Exactly.
It'll be so implemented so subtly.
Yeah.
So I want to hand over to you for a little while, Ellen, to give us some examples that you have noticed in the past few months working here with me, starting this new clinic, of when we're in with patients and I'm saying things and you're saying things and they're saying things. And then when we come out and we have our discussion after and you're like, oh my gosh, I can't believe this and this. So I'd love to hear from you some of these things that you've noticed.
Yeah, I think on my end, I've definitely been very shocked with some of the things that have happened. So first and foremost, people not being aware of filler risks.
100%.
Which is very scary because like vascular occlusions, they obviously can be incredibly, I guess,
dangerous.
Yeah, for sure. And Siri decided to chime in just then. And I think the biggest one that I've definitely had is patients not being aware that filler can be dissolved.
Yes.
And that Hyalase doesn't exist. The medication that dissolves filler is called Hyalase, which is really scary. I mean, obviously, if patients have permanent fillers, we can't dissolve that. But I guess it's always good to be aware of what's going into your body and that it can actually be dissolved if needed.
And patients need to know that, firstly, because of any of the complications, like you said, of vascular occlusion, legally we have to carry that medication to dissolve that if we have to.
Yeah.
But then in our consultations, we also say to clients, in that rare event that you didn't like your filler, or say you got, not an adverse event, but maybe you had some lumps and bumps and things down the track, is that we can dissolve that. And like you saw the other day in particular, there was one particular patient had been walking around with this filler that she absolutely hated, lumps, bumps, obviously from another clinic, not from us. And she had no idea when you started to explain to her that we could actually dissolve that for her.
Yeah, exactly. And that's kind of scary, I guess.
It's terrifying.
Yeah, like walking around feeling as though you
can't do anything about it, and you're just like waiting for this product to break down, which sometimes, and we'll talk about later in some of the questions that we've got, sometimes it just won't break down on its own, and you do need to dissolve it and start again.
Yeah, for sure. And yeah, not following post-care advice.
Yes.
We've had a few patients who will sort of like say in the consult that, I just lie down straight after my anti-wrinkle treatments.
I go to the gym.
Have a HIIT workout.
Go have another facial somewhere else.
Face massage.
Yeah. And then we're waiting for the 2-week review where they've got a dropped brow because they've, gone and done their, the best one I heard was I'd injected her with the anti-wrinkle and she said, oh, I'm going straight to do my upside down yoga, like hanging, there's hanging.
Yeah.
I was like, can we skip tonight, please?
Upside down yoga.
Did she take my advice or not? Who knows?
Hopefully.
I can confirm her brows were not dropped.
And another one is that nothing has gone wrong before.
Oh, I love this one.
So again, it's sort of like that expectation.
Yes.
I guess managing the expectations.
Yes.
And that like with every appointment, regardless of whether you've had anti-wrinkle in the past or if you've had filler in the past as well, things can still go wrong. Risks are risks. And yeah.
Totally. And that's why we talk about it every time. And
exactly.
I think that comment of, oh, well, nothing's happened before, or oh, you always do such a great job.
Yeah.
And well, yes, and we always strive to doing treatments in the safest way possible.
Yeah.
But no matter, any injector, any injection, any time, there is always that risk. And
Always
things
risks.
aren't going to be 100% the same every single time.
Yeah. And I think in the consult specifically, sometimes patients are like, oh, I know about that. I know about this. But legally, we do have to discuss those risks with you. And yeah.
Totally. And I just think, imagine if we didn't talk about those things and something does go wrong. And then in that moment where you're panicking, your patient's panicking, and then you're going, so there's this thing that I didn't tell you about, and now we're going to have to deal with that.
Yes.
That conversation is going to be so much harder than having that conversation prior, and then you're like, remember how we talked about this? This is what's happening, and remember this is how we're going to manage it. And the whole situation is going to be a lot calmer. For sure. And I also think really taking that medical standpoint with these treatments is that patients know what can go wrong, but they also have the confidence in us that we know what to do. Yes. So when we go, okay, these are the risks and this is what we would do about it if that was to happen. And also with that follow-up and that post-care, and this is some of the changes that come in with these new regulations, is around patients being really clear about what treatment they've had and how to get in contact with a clinic after hours. And this is something, again, that shocks me. I'm going to add another point to this section, is the amount of people who they've been treated by other clinics and they'll say, oh, yes, something happened, but I couldn't get in contact with them until the next morning. Or say it was a Friday night and the whole clinic takes the weekend off and this patient's got a complication that doesn't get dealt with until Monday morning. Whereas our patients always know that they can call us. Yes. And I have that phone with me all the time. I take that phone home, the clinic phone, and I check it regularly when I'm at home as well. And they always know that they can contact if there was something. And I would come in if it was at night. I would come in if it was 2:00 in the morning. I would come in and see a patient if I had to. Yeah.
And I guess as well, like for our patients, if you have a bruise that looks suspicious and you're worried about, it doesn't annoy us, you getting in contact. Yes. Like it, absolutely, so fine. We would rather that you contact us than not, I guess. And then you're just sat at home worrying.
And thinking that they don't have support, or thinking that maybe we did something wrong, or, a lot of the time our patients just need reassurance that what's happening to them, like you said, bruising or swelling, that's a normal process. But also it's great for us to make sure that we're ruling out that they're not having an adverse event as well.
And then lastly, our overseas patients.
Love them.
So in Australia, regulations are very different to overseas. So specifically patients from the UK who come to Australia, they get quite shocked that we prescribe our medications. Yeah. And in the UK, anyone can be an injector. You don't have to be a registered nurse. You don't have to be a doctor. So it's very
the
different.
Wild West.
Yes, it definitely is. And patients just get super shocked when they come here
Yeah.
and they have to have a telehealth consult with a doctor to get that prescription.
Yeah.
So
Yeah.
I guess like drilling that in patients as well when they come visit us, that
Exactly.
like you do have to be a registered
Yeah.
nurse or a doctor.
Yes, you
to
have to do
inject.
this. And if someone wasn't doing this, red flags.
Red flag.
Run for the hills.
Run for your life.